cervix is one of the very important parts of your anatomy. So in this video and the next one, I wanted to take a closer look at the cervix, tell you about what it does and some of the common problems that could affect it. Hi there, welcome to the channel. I'm Dr. Sylvia, a general practitioner and health educator with Ask Away Health. If this is the first time that you're coming to the channel, welcome. It's great to have you here. We share health information, looking at women's health and learning about our bodies and helping us to live better. So if this is the kind of information that you're here for, please like this video, consider subscribing to the channel and click the notification bell for alerts about when our new videos are published every week. Now let's begin by looking at what is the difference between the cervix and the womb or the uterus. The cervix is part of the womb. It is also known as the neck of the womb. Your womb is a muscular organ that can stretch and accommodate a growing baby. Every month after puberty, the womb prepares for the implantation of a fertilized egg. However, if there is no pregnancy, some of the womb lining is shed along with the egg as your menstrual period. The womb is located in your pelvis, just above the juncture of your legs. Your womb is lying behind your bladder and in front of your rectum. Your pubic bone in front protects these vital organs. Before you reach puberty, your womb is about the size of a small orange, about 3.5 centimeters. After puberty and before you get pregnant, your womb is known as a nulliparous womb. At that stage, starts to grow under the influence of hormones. The adult womb, before you fall pregnant, is about the size of a pear. But of course, by the last stages of pregnancy, your womb size will have grown many more times compared to what it was after puberty. So let's think about, what does the cervix look like? So we've said this is about the size of the womb in an adult woman after puberty before she becomes pregnant. The womb sits like this in your pelvis. That's the top or the fundus of the womb. And here is where you have the cervix. It's roughly about 2.5 centimeters. So your cervix is around this area of your womb. It is the neck or the entrance to the womb, and it sits at the end of the vagina. So it also is made of muscle. In this image, you can see the cervix is the lower part of the womb, as I showed you with my pear. This picture is taken looking straight ahead, but the second view is what your doctor sees when you have an internal examination and they pop in a speculum, and it's a circular view of the tip of the cervix. It does look like a donut. In the middle, you can see a small opening that is known as the os. The os is the entrance to the cervix, and it changes shape from a small pinhole before you get pregnant to a circle as wide as 10 centimeters when you're about to deliver your baby. And this image shows the os looking like a pinhole around the time of puberty or before birth. And on the other side, after you've had the baby, it resembles a slit rather than the hole. The position of your cervix can also change during your menstrual cycle. And by self-examination, many women can't locate and identify their cervix. Some women use the position of the cervix to help them identify their fertile period. It feels soft and higher up during ovulation, while it's firm and lower down within the vaginal canal during your less fertile period. So what does your cervix do? The job of the cervix is to act like a gate. It will either allow or deny entry or exit to and from the womb through the os. So let's see different ways that this can happen. 1. The cervix allows sperm to enter the womb and the rest of the reproductive tract. The os opens to allow entry during ovulation and closes up afterwards. In addition, it will allow menstrual blood to come out of the womb at the right time. 2. Sometimes they can prevent infections like sexually transmitted infections from getting inside the womb from the vagina. Another job of the cervix is cervical monitoring for fertility awareness. This is where you use the cervical mucus to determine when you are most fertile, to either plan a pregnancy or prevent yourself from falling pregnant. So the cervix produces a fluid-like gel or discharge known as cervical mucus or cervical fluid. Cervical mucus is different from one woman to another in terms of the quality, the consistency and color. But still, some common patterns or changes in the behavior, the nature of the cervical mucus can tell us what else is happening in the body. During your menstrual period, you may not notice the cervical mucus because the blood covers it up. Immediately following your period, you may be dry and not really notice any discharge. In the days leading up to ovulation, your cervix produces mucus that may be yellow, white, or cloudy. It may feel like glue or feel stretchy. Just before ovulation, the mucus can become clear and look slippery or watery. It may feel like the white of an egg, and this type of mucus protects the sperm and facilitates pregnancy. After ovulation, the mucus can then become cloudy or yellow again and become more sticky and gluey. Your cervical mucus can also change when you're pregnant. When it comes to vaginal birth, labor, and delivery, the cervix also has important roles. So here are some of the things that happen in your cervix around the time of your late pregnancy and delivery. When you go into labor, there is a plug of mucus covering the opening of the cervix, that is the os, which falls off. So that plug is essential for keeping your womb a safe, sterile space so that infection doesn't enter the womb and put the baby at risk. For most of the pregnancy, the cervix remains firm, stiff, and closed, which is meant to help keep babies safe and in place until labor begins. Usually the cervix softens and relaxes as you approach the last few days or weeks of your pregnancy. And this is what your doctors typically mean when they say the cervix is ripe. It simply means that the cervix is getting ready to open up and allow the baby to exit from the womb. In some cases, this does not happen, and so we say the cervix is unprepared or is unripe. It will need some help before labor begins, and your doctors can use some medicines which can be taken by mouth or applied through the vagina to soften the cervix. As your labor progresses, your cervix gradually stretches open when we say it's fully effaced at that 10 centimeter width that will allow baby to safely come through. So before we end up this video looking at the cervix and some of the things that it does, let's take a couple of questions. First, how to know if your cervix is dilating. Your doctor or midwife will examine you at intervals during your labor to know if your cervix is dilating. This means your os is stretching outwards and upwards to allow the baby to come through. And how to know if your cervix is softening. This is something else your medical team can determine with an internal examination when you're close to term and about to go into labor. So that's a broad look at the part of the body known as the cervix, and I hope you found this useful. In part 2, we'll be looking at some medical conditions that can affect the cervix. So if you're interested, make sure you like this one first, then subscribe and click the notification bell so that you know when that video goes live. While you're waiting, check out these two here, and I'll see you again soon.